Question number 321. A client present with hypocalcemia, hyperphosphatemia, muscle cramps and positive torso sign. So what diagnosis does this support? So option A, diabetes insipidus. Option B, Crohn's disease. Option C, hypoparathyroidism, and option D, acromegaly. So option C, hypoparathyroidism is correct answer, because hypoparathyroidism is a rare endocrine disorder where the parathyroid gland in the neck produces the insufficient parathyroid hormone, leading to the low calcium and high phosphorus level. Question number 322. The nurse cares for a client who has undergone a tonsillectomy surgery. So the nurse is most concerned about which post-operative finding? Option A, lack of appetite. Option B, throat pain. Option C, frequent swallowing, and option D, nausea. So option C, frequent swallowing is correct answer, because frequent swallowing, it will indicate the signs of bleeding. Question number 323. An 28-year-old man admitted to orthopedic ward complaining of throbbing pain in the casted leg. So which of the following nursing intervention should be taken first? So option A, remove the cast. Option B, notify a doctor. Option C, assess the pedal pulse, and option D, administer the PRN medication. So option C, assess the pedal pulse to assess the circulation, is correct answer. Question number 324. Doctor ordered to give the ofloxacin otic route. So the nurse understand that medication will be given. A, nasal, B, eye, C, ear, and D, sublingual. So option C, ear, is correct answer. Question number 325. Which of the following vitamins is necessary for wound healing? Option A, vitamin A. Option B, vitamin C. Option C, vitamin D, and option D, vitamin E. So option B, vitamin C, is correct answer. Question number 326. Infant with spina bifida. The nurse should monitor option A, head circumference. Option B, abdomen circumference. Option C, body temperature, and option D, respiratory rate. So option A, head circumference, is correct answer, because in case of spina bifida, further it will lead to increased cerebrospinal fluid. Question number 327. The nurse is assessing a 2-year-old child with the Wilms tumor. So which of the following should the nurse avoid? So option A, putting the child in lateral position. Option B, palpating the child's abdomen. Option C, putting the child in private room, and option D, provide the mouth hygiene 30 minutes after meal. So option B, palpating the child abdomen, is correct answer, because we avoid the palpation during the Wilms tumor, because further it can lead to metastasis. Question number 328. First dose of hepatitis B should be given when? Option A, at birth. Option B, at 2 months. Option C, at 6 months, and option D, at 1 year. So option A, at birth, is correct answer. Question number 329. Which of the following route is used to administer the diphtheria, tetanus, and pertussis vaccine? So option A, oral. Option B, intramuscular. Option C, subcutaneous, and option D, intradermal. So option B, intramuscular, is correct answer. Question number 330. A 2-year-old girl admitted to pediatric medical unit, significant weight loss, diminished mid-arm circumference, diarrhea, and red hair. So which of the following type of malnutrition do the nurse suspect here? So option A, marasmus. Option B, splitting up. Option C, kwashiorkor, and option D, rickets. So option C, kwashiorkor, is correct answer. Question number 331. 65-year-old man is undergoing the pre-operative preparation for endoscope procedure, in which the physician will visualize the large and distal part of the small wall, and with a camera attached to the flexible tube. So which of the following position is the most appropriate? Option A, left lateral Sims. Option B, right lateral recumbent, and option C, trundle work, and option D, prone. So option A, left lateral Sims position, is correct answer. Question number 332. To decrease the anxiety of a 10-year-old girl who is undergoing surgery, so which of the following should the nurse do? Option A, use a heart model to show her how the surgery will go. Option B, provide her with verbal explanation of the upcoming surgery. Option C, give her a book to read about the surgery 2 weeks prior. And option D, let her parents talk to her about the importance of having surgery. So option A, use a heart model to show her how the surgery will go, is correct answer. Question number 333. Which of the following indication for patient with MI? So option A, ST depression, option B, ST elevation, and option C, short ST, and option D, none of the above. So option B, ST elevation, it will indicate the presence of myocardial infarction. Question number 334. Which of the following vaccine is used to prevent meningitis? Option A, hip vaccine. Option B, varicella vaccine. Option C, BCG vaccine. And option D, rubella vaccine. So option A, hip vaccine is correct answer. Question number 335. Which of the following should the nursing assistant observe and record when admitting the patient? So option A, freckles. Option B, wrinkles. Option C, short nails. And option D, bruises. So option D, bruises is correct answer. Question number 336. Which of the following vitamin supplements can decrease the incidence of neural tube defects such as anencephaly and spina bifida in newborn? So option A, vitamin A. Option B, riboflavin. Option C, folic acid. And option D, vitamin K. So option C, folic acid is correct answer, and it will reduce the chances of neural tube defect. Question number 337. A head nurse of an intensive care unit wrote a report about the needs of her department and gave it to the nursing supervisor. So which of the following type of communication is this? Option A, upward. Option B, horizontal. Option C, diagonal. And option D, downward. So option A, upward is correct answer. Question number 338. In the hospital digital dashboard, what type of data displays? So option A, staffing. Option B, financial. Option C, performance. And option D, knowledge phase. So option C, performance is correct answer. Question number 339. Patient fall down in the hospital. So where is the nurse documentation? So option A, incident report. Option B, care plan. Option C, checklist. And option D, CADEX. So option A, incident report is correct answer. Question number 340. Which of the following vaccine is highly recommended to be taken by pilgrims before Hajj season? So option A, meningococcal meningitis. Option B, tuberculosis. Option C, hepatitis. And option D, poliomyelitis. So option A, meningococcal meningitis is correct answer. Thank you.